can see it and just call on people the way you would in a meeting.
Would he
Speaking of
prefer?
that, oh, sorry, go ahead, Ms. Foreman.
Oh, I was just going to say, would you prefer us to use the device here to raise our hands?
So I was just going to ask a question about that. So we got a few people on the call. Sonia, I want to try something, because what I was thinking is I would mute everyone and then you'd raise your hand, either actually raise it or do the click the hand raise thing, and then I'll unmute you. But on the phone, I wouldn't be able to see if you wanted to talk, I think. Sonia and... Oh, go ahead, Lisa.
No, it's crazy because I don't understand why I'm not on like face, because you know I like to show my beautiful face, right? So I don't understand like this. I'm just on the phone. Y'all laughing at me. My face is beautiful. Okay. So
I'm looking forward to seeing that beautiful face.
Right, and I want to show it. I want to show it. I really did want to show it.
Yeah, if you put everybody on mute, I'll just text you if I want to say something, okay, Ian?
Oh, right, and I will do this, and I will do the same. I will do the same.
Lisa, I'm sending you the link for the video now if you want it, over the email. And Eileen, are you okay with that too? If I do just kind of mute everyone, because I can see my texts on my computer actually. So if you text me, I'll unmute you. I'll know you have a call. Everyone on the phone okay with that system?
I'm fine with that.
I'm fine with it.
Excellent. Excellent.
I mean,
would
you prefer me to call?
Say that again?
I can call. I said, would you prefer me just to call?
To call?
I mean, would you prefer? Would you rather have the visual instead of the? Is it easier? I can just call right back on the.
It's up to you. If you're okay with being on mute and then just kind of texting me, if you might also be able to unmute yourself on your phone. I'm not sure how it works, but if you're okay with just kind of texting me when you have a question, then I'm fine with you saying on the phone.
Okay. All right. Thanks.
So let me see if I can mute everyone.
Are we ready to start? All right, we're ready to start. Ian? Can everybody hear me?
Yes, I put everyone on mute. Sorry.
Okay.
It was a success.
Okay. All right. My name is Shen'naque Butler. I'm the community health organizer with Banana Kelly. I want to thank everybody for coming out this afternoon. You know, spending your Friday afternoon as we do a Q&A with the Bronx doctor, Dr. Jane Bedell. Jane Bedell, she's a Bronxite, like lives here and whatnot. Is not like, you know, somebody who just comes from somebody who's like, she's a Bronxite. And she has been like doing awesome work here in the Bronx for the past 15 years. She has received the Salone Award for community service in 2018. That's basically like the Nobel Peace Prize of local government and whatnot. And she got that prize for the great work that she has been doing here in the community over at the Bronx Health Action Center over by Arthur Avenue. She also was the assistant commissioner to Dr. Marie Bassett. And this is actually kind of like not her first time doing something with Banana Kelly, because our very own Gregory Joss, she had put his redesigned the red line inside the Department of Health, showing the structural racism within government that creates poverty through lack of reinvestment and lack of resources. And she's definitely a great ally. And you know, I'm proud to say that I know her. All right, so without further ado, Dr. Jane Bedell.
Great. So fantastic that people are here. I'm always, as I was saying earlier, I think these are part of the kinds of conversations that people are finding really helpful because people have their own questions and their own wondering. And so I'm going to do my best to both answer questions and maybe engage in a little conversation also. And just to say something that was being said earlier while we were kind of in the pre-meeting phase, everybody knows this, but it bears repeating, that our knowledge about the virus itself is growing. It's not really changing that much. We're adding to it. We're not finding things that were wrong previously. We're just adding on new things as we learn more about how the virus works. So that's important. That's going to change over time. And the other thing is that as a pandemic or an epidemic moves across a population, whether we're talking about New York City, the Bronx, the South Bronx, however you want, the world, however you want to characterize it, it changes because some of us become infected and we're different than the people who weren't infected. And so that information is also going to change. So everything I'm saying today is today's information, and I'll try to be as accurate as I can. And I basically have three categories of the way I know things. There are things that I know for sure, and I can say that here's what we know. It's really what we know. It's not what I know, but what we know from the science or from studying how the epidemic is going throughout the population. There are things that I don't know, but I know somebody else knows them. And I don't happen to know that. So those I'm going to keep track of on my trusty old-fashioned clipboard here. And I will get back maybe either to Sean or Ian or Anita, somebody, anyhow, we'll loop back on those, the things that I know are known, but I don't happen to know them. And then there are things, and we need to be clear about these. I don't know them. You don't know them. Tony Fauci doesn't know them. Nobody knows them. And those are things that we still have to find out about. So just as long as we're clear kind of the limits and parameters of the conversation, I think that will help us as we go along. So I think we should just dive into it, if that makes sense, Sean, Ian? Okay, great. So handing it over to, I guess, to Ian to facilitate. How's that going to work?
I had to figure out how to unmute myself.
Yes.
Well, I think Anita and I were talking about maybe a good kind of structure would be going over what she called the epidemiology of the virus, and then kind of like a quick overview of like responses right now, and then I can facilitate some more of the questions.
Great. Okay. So that's great. And I'm going to try to keep it kind of New York and Bronx-ish, because I think people are hearing a lot and there's other sources for other things. So this is just kind of a reminder, and I'm going to try to take about 5 minutes for these just to get us started. So just a reminder, there are viruses, there are hundreds and thousands of viruses in this world of ours, and they are part of the world just like we're part of the world. And sometimes they attack other animals, sometimes they attack us, et cetera, et cetera. This is just part of, as I would say to my children when they were younger, even mosquitoes are part of the circle of life. So I know you don't like them, but they're part of the circle of life. Viruses are part of the circle of life. This virus is different for us because this is the first time that this virus is making its way into human beings. And it has particular characteristics that make us susceptible to it. So viruses like to come in. This virus in particular likes to come in. It likes the cells in our lungs, so it likes to get in there. And then it basically takes over cells, and it reproduces, and it throws all the little baby viruses out. And then we cough or talk or sing or touch the saliva that has little pieces of virus and then touch something else, and then another person can pick it up. So that's how it's spread. It's spread both through what's called respiratory droplets. That's mostly microscopic, but little droplets that shoot out from us and then, like the name implies, drop. Some of them, for a little while, hang around in the air. That's one of the things that's making this virus easier to transmit. And then they drop on a surface. If I'm infected, they drop on a surface. My son comes by and he touches the surface, and then he touches his mouth. It'll get into his mouth, and then actually it touches his nose, get into his lungs, because this virus likes lungs. So that's how it's spread. And even though I just said all that stuff about how we don't know many things, right now, today, and I'll say this probably many, many times, right now, today, we know enough right now, today, to break the chain of transmission. We know enough right now today to break the chain of transmission, and that's important. So when you get all confused, as all of us do, about all the information, is it this, is it that, it's important to get back to the basics. And the basics are, since it's something that's in people's lungs and then comes out in droplets, if you're far away from them, you cannot get it. I pick up the phone here in the Bronx, I call my brother in Brooklyn. He cannot get it from me, even if I'm very, very sick with it. If my neighbor is across the street here and I'm talking across the street, my neighbor cannot get it from me. These viruses don't jump out of people and then fly around and get the next person. It's not how it works. So we know that distance is important. That breaks this route that involves the air. And then for the droplets that land on surfaces, washing your hands, the magic of 20 seconds of soap and water, which is enough to kill the virus. So, and how do we know that we know enough? We know that we know enough because countries are obliterating the transmission of the virus. They are breaking the chain of the transmission of the virus, as we are doing in New York City right now. We are doing a freaking fantastic job right here in New York City. We had days, I've been keeping track on my little, also very low-tech crib sheets of all the numbers every day, which I have pages and pages of numbers of the numbers of cases and the numbers of deaths. And, you know, just looking back as I was doing in preparation for this, there were days not that long ago when 400, 200, 300 people a day were dying. We haven't had a day with over 100 deaths in a week. That is incredible. So that means, because it takes about 20 days for people who are gonna die, I hate to be all blunt about it, but it takes about 20 days from the infection to dying. This means that 20 days ago, New York was doing the right thing, and we're probably only doing more of the right thing. So we know enough right now to break the chain of transmission. And how do we know that? Because we're watching it happen. The curve that was on its way up is now on its way down. Not as fast as we want it to be, but still going down, because we'd like to have this virus out of here. So that's important to say. And the other thing to say is that although some people say the virus doesn't discriminate, that's true, but the virus interacts with people and people discriminate. And the systems that we have set up that have discriminated and unfairly advantaged some people and taken wealth and resources and opportunities away from other people, we're seeing that play out because the virus likes to be transmitted in certain social human-to-human conditions. So I'm lucky. I live in a house in the Bronx. That's kind of amazing because there aren't really too many single-family houses in the Bronx. But I do. So I'm incredibly lucky. If I were to get sick, it would be relatively easy to separate me from the rest of my family, and everybody would try hard, and we would probably not transmit it from me to the other people in my household. If I were living in an apartment where I'm sharing the same bathroom as 5 other people, there's one small kitchen, and I share a bedroom with somebody, we're all going to try really, 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 really hard not to transmit that virus, but it's going to be unduly hard for those folks. So the social condition, the conditions in which we live or work, because people are reading about that. If you work in certain crowded situations and you cannot worry, there's no way you can do meat packing at home. The meat packers have to go to the meat packing factory. So they are at tremendous risk, as we've seen. So it's true that the virus doesn't discriminate. And it's also true that the virus is in an interaction with people, and people discriminate. And the policies that we have had in the past are giving us the conditions that we're living with right now in the present. And we need to think about that, because the policies that we set up now are going to inform the future. So we are absolutely seeing that the virus is in more, in certain areas, workplace, where people are crowded together or have a lot of interactions with a lot of different people. and everybody in New York is pretty aware of those. And then housing conditions that are overcrowded, to use that term. And, you know, we could have a whole discussion probably with everybody here, but Sean's the person I know the most. So Sean and I could have a conversation for like several hours on why it is true that some people, you know, have the whatever, you know, undeserved privilege of living in a bigger place and other people live in overcrowded conditions. So that's a setup for the virus to be transmitted. And that's the thing that for some people is a bit of a wake-up call. I have to say probably most people on this phone call not shocked. Once I heard that this virus in particular, the way that it happens to work biologically is that if you have other conditions like hypertension or diabetes or heart disease, or you're older, that means you're more at risk. I was like, okay, older, that's evenly distributed. But those other conditions are not evenly distributed in this city, as I full well know, having studied and worked in and talked to, you know, and I've been working and taking care as a doctor of people in the Bronx since 1987. So that's you know, I've, you know, learned so much about that. Those conditions are not, sure, anybody could get hypertension, but there is more uncontrolled hypertension in people who can't get medical care and et cetera, et cetera. So I won't go on that, but just to say that the virus doesn't discriminate biologically, but it interacts with human beings. And since human beings have a history of discriminating, we are seeing the results of that. And that means we have a chance to change that for the future. So I also want to try to pivot us in some of the questions and responses to what's the response going to be and how are we going to respond today, but how are we going to set things up so that our kids are facing a different reality than the people who are young adults today. So I'll just, yeah, that's a little bit more than 5 minutes, but then we can go from there. I'm trying to get a couple of different thoughts in there, if that's okay with everybody.
More thoughts, the better. And thank you so much for doing this and playing your part in making that better reality actually happen. We really appreciate the work you're doing. And we know that you're getting pulled in a lot of different directions to be able to do that good work. And I know that if you have to go, you know, we all understand and just let us know. And I guess in lieu of you being pulled in another direction, we can open it up for some questions for the next half hour, 45 minutes or so. But again, we understand your time is precious. Just let us know. And thank you again. So God knows I have a million questions, but and for people who came on after we already said this or didn't get a text, oh, and Anita just had a hard time getting in because of a password. Did anyone else? Well, actually, you're all on mute. Never mind. But for the people who came on late, I have everyone muted. But if you have a question or want to raise your hand and you're on your phone, you can type *6 to unmute yourself or *9 to raise your hand, and I'll unmute you. So, does anyone have a question? Raise your hand or use your phone to unmute yourself.
Oh, Ian, can you hear me, Ian?
I can hear you.
I can't hear you. All of a sudden, I think we all lost the sound. Do the other people who are on the video, is that right? I can't hear Ian. Ooh,
I
that's
hear
weird.
him.
I can hear him.
I can hear him.
And it looks like you're unmuted, Ian, but I still can't hear you. Say something.
Can you hear me now?
No.
No?
Sean, can you
anyone hear me?
Ian?
Yes.
Yeah,
Oh,
I can hear.
Can't hear Ian.
Huh.
All right, hold
on.
Let me.
I'm gonna leave and rejoin. Maybe that'll reset it.
Here.
We hear you.
We hear you.
Okay.
Dr. Bedell can't.
Let's try that.
Did that work? Can you hear me?
Yeah, it's better. I don't know.
Okay.
Sorry about that. Okay.
No. Lisa, you're up.
So the first question I have, well, I have several. This is coming from the tenants, though, not from, more so for me. So the first question I have is that can the virus go through more or less meat? And I think that question came about in one of our meetings. We talking to a couple of tenants. And the reason why they asked that question is because being that it goes through
like, I guess, your nose or your mouth or whatever, being that a meat is like some form of a type of, it has organs and stuff like that, whatever. But can it go to meat? Let me just cut it short because I'm about to go on and on.
Can it go through, what's the word?
Can it go through like your food products like meat?
Oh, the food. Okay, yeah, that's such a great question. Thank you. Sorry. I'm a little hard of hearing and something happened to my speaker, so I gotta really pay attention even more than I need to. So there are some viruses that are called foodborne illnesses. So some people might know some of those. There's one form of hepatitis which is itself a foodborne illness. Gets into the food, and then that virus happens to like to hang out in our digestive tract and use the digestive tract to reproduce. This virus does not like to hang out in food. It doesn't survive. And the acid that's in your own digestive system, starting really in the mouth, but particularly in the stomach, kills the virus. So that's why you notice from the beginning of the whole pandemic in New York, there was no restriction on takeout food because there is nothing in particular about food itself as a route of transmission. The worry was that we're all crowded in restaurants and talking to each other, and that was the transmission, and that's why the restaurants shut down, not because of the food. So that's a great question, because food is safe. Now, some people, I'm just gonna take, if it's okay, another question which sometimes comes up. Okay, I go to the grocery store and I touch something and I look at it and think, nah, I don't really want this. I put it back, right? And maybe 20 people have done that already with that thing. So now what about my hands? Okay. It would be hard for you to get it that way, but if you're worried about that, and I'm like, I have some conditions myself, so I'm worried. I'm over 60, I have hypertension, and I've had very bad cancer, fortunately, all is well. So I got 3 strikes against me right now. So if I go shopping, I get back to the basics. First of all, of course, it's the law, but everybody should be wearing a face covering. And in terms of touching things and touching food, I wash my hands before I go out. That's really to keep other people safe. And I wash my hands when I come home. I put my groceries away and I wash my hands again. When I'm about to prepare food, you know, as we all should be doing anyhow, I wash my hands before I prepare the food. And then before I sit down to eat, I wash my hands again. That's a lot of hand washing, but washing your hands is one of the fundamental ways that you can break the chain of transmission. So if you're worried about anything that you've touched, after you touch it, don't touch your face. Hard to do, but I think we're all getting into that habit. And then as soon as you can, wash your hands, the magic of 20 seconds of soap and water. Plan B on that is the hand sanitizer. I have a little thing of hand sanitizer on my bike because I do my shopping on my bicycle. And when I get on the bike, I put the hand sanitizer on because I've just been in the grocery store touching stuff. So it's not in the food. But if you're worried at all about anything that you've touched, don't touch your face until you wash your hands. And then you've broken the chain. It's a kind of a funny thing.
One more question real fast. With the hand sanitizer, because even before this corona came about, right? One thing with the hand sanitizer, they said if you use hand sanitation so much, it's not effective no more, right? So now.
That's not true. No, that is not true.
Okay.
That is absolutely not true.
That's a myth.
Hand sanitizer works amazingly. It's not as good as soap and water really, but it's a really good plan B. So, you know, because we can say for sure the soap and water in 20 seconds. Hand sanitizer, there's a lot of things about how much it evaporates and whatever that makes it just a little bit more difficult to be definitive, but it definitively kills the virus. And this virus, and here's one of these things that we're going to say, and then this could change. It's unlikely to change on the sanitizer killing the virus. The hand sanitizer has a chemical in it, a type of alcohol, that just breaks that virus apart. The virus is easy to transmit, but it's actually very fragile. Sunlight kills it. Hand sanitizer kills it. Soap kills it. I was going to say something else kills it. A lot of things kill it. Acid, the acid in your digestive tract kill it. So it's true that it's easy to transmit, but it's also easy to kill it. Hand sanitizer, you use that hand sanitizer as much as you want. Every time it's just as good as the first time. Does that make sense?
Thank you so, yes, thank you so much.
Okay,
Awesome.
great.
We got a hand up. I'm going to mute you, Lisa. And then we got 917-727-7158. Not sure who you are, but you're unmuted.
It's Aline. It's Aline.
Hey.
Hey, yeah, sorry, that's my Google number. Just a quick question regarding, I'm noticing that when I'm out, especially in the grocery stores, people seem to have the mask on, but not gloves. And even where the masks are concerned, they're just wearing it over their mouth and not completely covering their nose. And many of the stores here, the cashiers are not wearing gloves or masks. So in terms of gloves, is it really necessary? Isn't it just as necessary for people to wear gloves as it is the mask?
So the issue about gloves, so what's the purpose of the gloves? The purpose of the gloves is that you might touch something that has the virus on it. So now the virus is on the glove, right? If you can follow logic. Okay. If I take my gloved hand, I don't have a glove around here, but if I take my gloved hand and I touch a hard surface like my watch and it's covered with virus, and I touch my mouth, I'm infected. So the glove did not protect me, right? Because I touched a hard surface with the virus and then I touched my mouth or my nose. What would protect me, and the why people wear gloves, is when you're in usually a medical setting and you're touching a lot of things, and then you don't touch your face, but you take the glove off. Now the virus is in the gloves, you drop the gloves into the garbage or whatever, and that's where the virus is, and it's not on your skin. So the gloves are only as good as your habit. If you wanted to put gloves on, not touch your face, and then when you came home, take the gloves off, that would be like washing your hands. You can live without gloves completely by observing good hand washing and hand hygiene. And whether you have gloves or you don't have gloves, if you touch the hard surfaces and you touch your nose or your mouth, you could be potentially infected. So I think the thing that I worry about is that people have the gloves on and they think that gloves somehow make them immune. The gloves do not make you immune, because you could just transfer the virus from the hard surface via your gloved hand to your nose or mouth. So the glove, and that's why you see that there isn't a lot of guidance on the City Department of Health website about gloves, because the hand washing is really the more fundamental thing that we have to get back to break the chain of transmission. So that I wouldn't worry about, as long as those people are washing their hands or using hand sanitizer. That's up to them. I mean, I've talked to the folks in my grocery store, and some people prefer to wear the gloves. It's just easier, and other people keep a little thing of hand sanitizer. Some people do both. Sure, that's overkill, but it's fine. Do whatever makes you comfortable, as long as it's in the right direction. So the gloves are helpful depending on how you use them, but they're not absolutely necessary to break the chain of transmission if you're using hand hygiene, washing, et cetera, et cetera. So the face covering that a lot of people are wearing, that looks like that and it's drooping off, and for people just on the phone, we've all seen, and maybe some of us have been a little guilty of that ourselves, because it's uncomfortable sometimes, or you just, you're not used to wearing it. It is, it's important for people to wear the face covering so it covers their nose and their mouth. And I'm wondering what people's strategies are to help remind their neighbors, their friends in the store, their people who they don't know in the store. Because those people who are walking around without covering their face are putting me at risk, and you, and whatever. They're not protecting themselves, which is what I think a lot of people think it is. They're protecting the rest of us. So they're getting it mostly right if it's over their mouth. It's not terrible, but we're going to do a better job in New York City if everyone is more firmly adhering to the right guidance to put the face covering over the nose and the mouth. And I'm wondering, I'm wondering what they do. And there are some countries where it's kind of 100% face masks. How did they do that? How can we do that? So I think that's worth a conversation. So we had, and I'll just say one thing, I see some other hands up. There was in my neighborhood, a group of young guys who I think they used to like to hang out at the basketball court, but now they can't because no basketball court. And I feel bad for them. And and some of them are wearing face coverings and some aren't. So some of us on my block said, what are we going to do? And I kind of know them enough to say hi, but I'm sure to them, I look like a crazy old white woman. I'm like, maybe I'm not the best person to start that conversation. Maybe I am, maybe I'm not, I don't know. Anyhow, we had like a little huddle of my neighbors and we nominated my across the street neighbor who sometimes plays basketball with them. And he chatted with them. And he said, look, guys, you need to be a little bit further apart or wear the face covering. And here's why, because he knew a little bit of it. He said, because the young kids are watching you. They go by on their bikes and their scooters and you guys, they look up to you. So he sort of put in their mind, don't do it for yourself or for me. He's an older person also. Do it because you're like a role model. So far it seemed to work. So we need to have those kind of conversations. And they were kind of like, oh yeah, okay, sure, yeah. I mean, it was fine. So I think we have to think about how we're going to encourage each other and be generous with each other and in the best way that we can help us all, follow the rules. So
okay, just for clarification.
Story, because I think that's important. It shouldn't be like slamming people. It should be like, how can I help you do that?
Awesome. And just for clarification again, how long does it live on a hard surface?
Good question. So that's one of those, I don't know, you don't know, and nobody knows. Okay. We know that it is more than a few minutes, and it could be more than a few hours. It is unlikely to be more than a few days. So I'm just giving you the parameters of how long, and it's not only how long it survives and could infect a person. And so there's some geeky science in there, but just to say, just because I find a lot of virus fragments, that doesn't mean that that virus could have infected somebody. So that's why we don't know. We know a lot about how long we can find virus fragments for. It's like a couple of hours, but it's unclear whether those fragments could really infect a person. So I think we should assume, when we don't know too much, we assume kind of the hardest thing to comply with, which would be hours to a day. And, what does it mean? It means if, we should all be staying at home and not having people over to our house. But if you had somebody over to your house, you want to wipe down those surfaces. Or, what's more likely, at least, for some of us, is that we're going to be around somebody and we're going to be in a house, sharing a household with somebody who has it. And we can make everything safe by wiping the surfaces after that person uses the bathroom or the kitchen, etc. So the short answer is we don't know, but we know enough to break the chain of transmission because just wiping it with a disinfectant kills it.
Thank you.
Thank you. Thanks, Eileen. I'm going to throw you back on mute, and I know Shen'naque had his hand up. In terms of trying to kind of talk with other people about wearing, masks and stuff like that, we're starting to have conversations like that and try and figure it out, and it's such a context-based thing. So maybe some buildings, we just got a bunch of helpful information from Anita that we can print out and post up, the facts versus fiction, kind of myth versus reality stuff, because a lot of people just might not know. Like you said, they think they're protecting, themselves. It's really protecting others. There just might be a lot of misinformation, but we're brainstorming how to do that too. All right, Shen'naque, you're unmuted.
All right, I have 2 questions. One will probably be really quick to answer. There's been a bunch of information out about how to make your own hand sanitizer. And one of them was alcohol. And a lot of our Bronx bodegas, they're selling bottles of alcohol that are 50%. If someone was to take one of those bottles, put it in a spray bottle and spray their hands or spray a surface, would that be effective in killing the virus? And number 2, the second question is, I'm hearing a lot about telehealth these days, but I'm not quite sure exactly what it is, but I'm hearing that it's been out for a while. And, you know, could you explain more of it, of the telehealth situation where our community is not getting that access from what I'm hearing? I could be wrong.
Okay, two great questions. So when you say alcohol that people are using, do you mean the
Rubbing
alcohol,
alcohol.
the kind of alcohol you can drink?
No, I mean rubbing alcohol.
So the alcohol content has to be at least 70%. So 50% does not cut it. And that matters actually quite a bit to kill the virus. On the City Department of Health website is like a list or a link to a list of products that are absolutely known to kill the virus. And I would hate for people to think that they're doing something completely right. Hey, I'm using it. And then they're using something that's too weak to kill the virus because they're doing exactly the right thing, only it's the wrong chemical solution. So, you know, most standard, I don't have the list in my head, but oh, it's such a long list of standard household cleaners that are fantastic at killing the virus. I would discourage people from home remedies on virus killing. I think there's so many easy to get things, you know, there's a solution of bleach that will do it. Bleach is very available and cheap. You have to dilute it. Bleach has its own problems, which it's very strong. And so you got to be careful with it because the vapors of the bleach can, you know, you don't want people to hurt themselves using chemicals that are killing the virus. But there's so many solutions out there. So I would discourage home remedies. And now that whole beginning period where it was hard to find disinfectants, we are largely through that time period. We're not getting reports that those shelves are bare. So, and if people hear that, that would be something great to relay to Anita, because the city is working hard to track that. There could be a moment, you know, a day or two when there's something in a little bit of short supply. But for the most part, those early supply problems, which were really distribution problems, have settled themselves out. Okay, so does that make sense for the alcohol? I just think we have so many things that we know work so well that nobody should risk it on a homemade remedy.
Okay.
It's too risky to do that. The stakes are too high for that. And, you know, again, I don't want to put Anita in a bad position, but if people are feeling like they cannot get the right disinfectants, that would be something to let her know, and she'll try to figure it out in the short term, but also what's the long-term solution.
Well, that's great that you said that, because we are finding it hard to find like Lysol and things of that nature in our stores and also in our 99-cent stores and our bodegas. It seems like they just don't have it. But since people are hearing that, oh, well, if I use rubbing alcohol and I buy that, that would be a substitute for something like Lysol. But the bottles of rubbing alcohol that the bodegas have and our 99-cent stores have are all 50%.
Yeah, so
50%. So like you said, people will be thinking,
mostly rubbing alcohol is 70%. So that also means that it's sort of, you know, that's interesting from a selling point of view. But no, 50% doesn't cut it. So yeah, and so I know Anita's on the call.
This sounds like an interesting possibility for the organizing campaign around that. Just throwing that in there.
And you know, it would be great if we had any kind of assessment about, you know, is this like a constant problem? Is it in certain kinds of store, whatever, you know, data we can get. Okay, so let's talk about telehealth. So telehealth existed before. So telehealth is the idea that just as we're doing this meeting via a video screen and audio, that you could, you know, quote unquote, visit with your doctor or nurse practitioner or healthcare provider via a screen. For example, in rural areas, it is, up until this point, have been used more because for some people in a rural area, I know a little bit about the Veterans Administration system. They have a pretty robust telehealth system because they have some veterans who live an hour or 2 or 3 away from their nearest Veterans Administration provider, and they want to stick with that doctor, but it's hard. So they've developed this telehealth way of doing most, not all. Obviously, there are some serious shortcomings to telehealth. I can't take your blood pressure. I can't listen to your lungs, but there are technologies to help healthcare people do some of those things, and those are evolving. Many practices have switched to telehealth during this time period for people where it would have been just a regular routine visit. And sometimes the telehealth is just the telephone, and sometimes it includes like what we're doing. As the higher up the need for technology, the more you're going to systematically exclude certain people. And it's not only about having a phone or a computer, it's about the bandwidth issue, about whether or not you have enough bandwidth to do this successfully. And the same issue is happening with education and trying to use advanced technology for distance learning. So that's another thing we would be interested in, how are people keeping up with their healthcare? We're quite concerned that there's been this time period where people have not been able to access the care that they would normally have gotten. And maybe they're postponing things that really need attention. Or maybe there's so many little obstacles to getting the care that they're kind of giving up too early. So we don't know the extent of that yet. What we can say is that some things got a little bit better because we were all at home and not putting ourselves at risk as much. So ER visits for trauma have gone down actually substantially during this time period, for a whole host of reasons. People are not driving cars, and the streets are a lot safer than they were. So all of those things that the ER visits for that have gotten lower. But we're quite concerned about people, particularly with chronic illnesses, that need attention. So it's something, again, Anita might know a little bit more about which places are able to do good telehealth. And I will say that right now, the other thing that's happening is people feel like they want to be in touch with a doctor about whether could I have COVID, how should I get tested, whatever. And Health in Hospitals has done a pretty good job. There have been some little blips in it, but it's been pretty good. If you call 311 and say that you need to speak to a doctor, you will get connected to somebody between, I think it's either 8 or 9 a.m. to 9 p.m. I think it's 8 a.m. to 9 p.m. So the city is trying to systematically make healthcare more accessible for people. And then people should ask their own doctors and be calling. Now we're more than several weeks into this. Most clinics have figured out how to do some outreach to their patients to make sure they're getting their meds, they feel okay, and they're not suffering during this time period.
Okay.
Cool.
All right.
Thank you.
Thank you.
I'm going to mute you again, Shen'naque. Anyone else with any questions? I'm kind of paranoid about the people on the phone. If I see someone. There you go, Sonia.
Hi, it's me, Sonia. Hi. My own question is, it's allergy season. I am coughing. I'm feeling strange. What happens when people feel like that? The first alarm is, do I have COVID, or is it an allergy? How do we reassure ourselves that it's not COVID if we're suffering from this type of effect?
Yeah, great question. And so can I ask you, if it's okay, you don't have to say, what do you normally do? Because you say you have allergies. What would you normally do if we weren't in the middle of a worldwide pandemic? What would you do?
I usually, I would take the nose spray and a little bit of cough medicine. Yeah, I usually would take cough medicine during the night because the coughing seems to be more assistant, especially during this time.
Yeah. So, I would say if that's worked for you in the past, that's a good strategy. We haven't talked about testing, but this gives me a good opportunity to talk about testing. Anybody who feels concerned that they might have COVID now can get a COVID test. And the reports that we're getting are pretty good, that it's relatively easy to get. You can call 311. It's also up on the city's coronavirus website. It's pretty, and the list each week is growing longer of where people can get a test. So we encourage people to get a test. If you have any question at all, oh, you know, my phone is ringing and I forgot to say that there's one thing that I might get called for. I'm going to mute myself for a second and get.
No problem at all.
Okay.
Cool. I'm going to save this chat also because P. Ferrante from DOH just sent a link on getting tested. I'll send this recording around to everyone after, but I'll also try and send like a collection of the different links being put in the chat.
Sorry about that. I have two things that are going to happen. This one and then in about a half an hour. But we're good for time. So
and one more quick question. I know you're the human doctor. I have two pets, two dogs. I take them out. I know you're not a veterinarian. Cocker Spaniels, they love to stick their nose in the ground. Is there any suggestion? I've been cleaning them with baby wipes. Any suggestion on how to keep them clean and keep them safe?
So, okay, so let's do the dogs first. The virus does not like dogs.
Well, thank you.
So I'm showing how old school I am, but so the WHO, I don't know, about a month and a half ago, issued a thing about dogs because this question kept coming up on a worldwide basis about the dogs. And so they did a whole investigation into the dog situation because that would have been a very troublesome mode of transmission. But fortunately, they found out that dogs are not transmitters of the virus. So my brother texted me something that said, because, you know, WHO, some people call it the who let the dogs out? Woo. So the dogs are out. They're fine. Don't worry about the dogs.
Okay.
And, you know, you have to be a certain age to even know that song. My kids are like, don't sing that song ever. So don't tell them I just did that, okay? So
you recorded the whole thing. So it's permanent.
That's right. Oh my God, I'm in the doghouse. So don't worry about the dogs. So the other thing about those of us in public health and in science, we never like to say zero. So could somebody who is super infected have it on their hands or sneeze all over your dog and then you touch that dog immediately and you put your hand, yes, could that happen? Yes, it could. It's not been known in any of the case reports as a mode of transmission. And just, you know, people should know that by now the case reports are in the thousands. So in China, in Wuhan, they have done contact tracing for over 1,000 people. And they interview each of those people and they work with them to figure out how it is that they got the virus. Of course, it was all accidental. Nobody wants to transmit the virus. And so far, animals are not implicated at all. So you're pretty safe with the dogs. So, and about things like a cough and everything, again, if people have symptoms that they're worried about, they should then, of course, take extra cautionary measures and go get a test and find out for sure. And there are two kinds of tests. The one that I'm talking about is the do I have the virus right now test? Am I infected right now test? There's a separate test called the antibody test. That measures whether or not you ever had it, even a month or two ago. So the test that you can get easily, I mean, both of them will come up, but the one you're most concerned about is, do I have the virus right now? And the person at the testing site will talk to you about your symptoms. And it's also a place, if you don't have a doctor, if it's a health and hospitals place, they'll hook you up with a doctor or a nurse practitioner. So you can get a lot of a lot of good stuff in the testing thing. And we want to encourage people to get tested because now we have enough testing, fingers crossed. In the beginning, we didn't have enough testing. We had to save the tests, but this is one of those things that has opened up more.
Thank you.
Thank you so much.
Thank you.
Sonia, I'm going to put you back on mute. We got Ms. Foreman next, and then whoever is on the phone with ending in 7158. But since you just brought it up, I hope this is okay. I was hoping maybe you could talk a little bit more about the antibody test, because there's been different information that I've been hearing about whether you can trust them or kind of when to get them. And maybe you could just talk real quick about that, and then we'll go Ms. Foreman and then the person on the phone.
Okay, does that sound okay with everybody? Okay, so like I said, there's one test, that's the Am I Infected Right Now test. That's called the PCR test. And it looks for actual little pieces of virus. And that's the most important test right now because that's what we're concerned about. Then there's this antibody test. It is true that in the beginning, the federal government let a lot of different pharmaceutical companies make the antibody test, and some of them made a better antibody test than others, a more reliable test. So it matters where you get the test. You need to go get the test from a place that you trust. Health and Hospitals is using a very reliable form of the test. That I know for a fact. I'm imagining that other big medical centers are also using very reliable forms of the antibody test. I would be more concerned about a small little practice, not sure which type of antibody test they are using. I think over the next few weeks, though, this is all going to be settled out because the ones that are better are going to emerge as the ones that everybody is using. So right now it's a little bit of an issue, but if you're a betting person, you're going to bet that that's going to be less of a problem over time. But the more important question is, why do you need an antibody test? Why? And the short answer to that is you don't need an antibody test because there's nothing different that you're going to do based on that test. You might want it. I have neighbors, they actually were COVID positive. And they had a curiosity, okay, and they knew they were positive. They got tested. They were pretty sick, so they got tested. All has worked out well with them. And then they were just curious, is my antibody test going to be positive? Okay, that's a perfectly fine reason to get a test. It's not going to change anything they do because we do not know, unlike other viruses, we do not know whether or not if you've had the infection, whether you can get it again. We don't know the answer to that. We're going to know the answer eventually, but we don't know it now. And because we don't know it, what I said earlier applies. We have to take the most cautious approach. We have to assume, until we know more, that it doesn't mean that you can't get it again. There are some viruses that you can get again and again, or some viruses where you're immune for a short period after you have the virus, but then your immunity goes down. Short period, 2 months, 6 months, 12 months, 2 years. That's one of these. Well, this is in the category of nobody knows the answer to this. So on an individual level, it shouldn't change anybody's behavior at all. You should, even if you're antibody positive, and even like my neighbors, if you know you had COVID, that test was positive, you're antibody positive, those neighbors are so cautious. Absolutely face coverings when they're outside, nobody else is going into their home, super cautious, and maybe more cautious even than your average person because they know how terrible getting the sickness was. So it should not change your behavior, whether it's positive or negative. Absolutely, same protections apply. So why do we have the antibody test then? We have it because the city and the country and the world is interested in knowing how many people have had this virus in our city so far. Is it a little small number? Is it a big number? That's going to help us. Have most healthcare workers had it, or most haven't had it? Have most nursing home residents had it or most haven't had it? That's going to help us in the public health world put our resources in the places that need it the most. So it's quite helpful for planning around resources when you look at like a whole group of people. It's not as helpful, although if you're curious about it, sure, get one, but it shouldn't change your behavior. So this is one of these things that's kind of interesting, where on the one-by-one level, not so helpful. On the mass population level, going to be super helpful so that we can plan and make sure that we've got the resources going in the right place. So does that get to your question, Ian?
Oh yeah, no, totally. I didn't have a specific one other than just kind of like wanting to know a little bit about it. And I didn't know like the difference in test manufacturing is fascinating. And that question of why get one is, that was super helpful. Thank you.
Yeah. Oh, and let's just say the one, am I infected now? That's either a swab up your nose, which is, you know, uncomfortable for a second, or now they're developing a way of getting saliva as well. So those are all have to do, because we're looking for the virus. Do you have it now in the places the virus likes to live, which is your nose or your mouth? And the antibody test is a blood test through a vein. So that's another way of thinking about it. Is it the blood test or the, you know, the fluids test? Okay, and then I think Ms. Foreman had a question.
Yep. Hold on, Ms. Foreman. There you go. We should be able to hear you.
Yes, Dr. Bedell. I'm hearing a lot of information, so it makes me curious on persons who are testing positive, even though they have, you know, followed their procedures and the lockdown. They wore their mask if they had to go out for essential reasons. They're still testing positive. So this is, even though they don't have signs of the virus or anything like that, but they're testing positive. So I'm just curious as to, is this part of how the virus itself is showing up? Like people are testing negative that are positive and vice versa, positive that's negative.
Yeah.
So
yeah, great. That's a great question also. So we're pretty sure that when somebody tests, so I'm talking about the one that's, and let me ask you, are you talking about the blood test, the one that, or the am I infected now test, or both?
I'm really both.
Yeah.
But I guess the most prevalent will be the one that's, am I infected? Do I have it now?
Yeah, okay. So that's super important to talk about, because this virus, and this is just, I mean, it's one of the things that makes it have a difficult chain of transmission. This virus is sneaky. I can have the virus and I can feel pretty much fine, not have any symptoms. And I not only have it, but it's in my little droplets that are coming out all the time microscopically while I'm talking. It's in the fluids in my nose. And I don't realize it, but I'm infectious. And the test will be positive and I will feel fine. That's really sad, because now it's really hard to find that virus. In Wuhan, this week and last week, I mean, it's kind of amazing. They're trying to test every single person in Wuhan for the virus right now. I think it's like 8 million, 11 million, some, you know, but they were hard hit in January. But they want to get a grip on who's got it now. And we can't just ask people, do you have a cough, fever, feel lousy? Because you'll get most of the people, but there's a substantial minority of people who have the virus and therefore they would have a positive test and they feel okay. That's why we've all had to shut ourselves in for all these weeks, because we want the virus, everybody who had it, who got it in, you know, February and March, to have it and be done with it. And now, you know, as we start to ease up on the restrictions, we'll I hope, oh my God, make sure that it doesn't emerge. So the short answer is, it's not a false result of the test. You can test positive and have the virus and even transmit it and not feel like you have the virus. And that's the sneaky way this virus is. By way of a backdrop, I will say that all tests, there's always a tiny, tiny fraction that can be falsely positive or falsely negative. But this PCR test, am I infected now? That test is a really, really, really good test. So it does not have, it performs really well, and it's similar to a lot of other tests that we use to detect HIV, to detect Ebola. We have a long history in the healthcare field in using that technology to detect viruses. So that result is pretty darn reliable, both the positives and the negatives. If it's negative, you don't have it. If you feel sick, you might have some other virus. Remember when we all just used to get a cold?
Yeah.
Yeah, well, that's still happening. So somebody can feel lousy and have a cough and have a fever, and then they go, oh my God, I have COVID. And now you can go get a test. If it's negative, guess what? You have another virus. You have a cold, a regular cold, but it's not COVID. So that's such a great question. And we're all going to have to learn more about all this testing so that we can be smart about it and use it well. And there will be more testing. And that's what's being worked on now. How are we going to have a good strategy so that people can go back to work safely? Can kids go to school safely, et cetera, et cetera? Testing will be part of that strategy.
Cool.
Great
Thank
question.
you, Ms. Foreman. I'm going to mute you again. And then 917-727-7158, you're up.
Hi, this is Elaine again. So I have a couple of questions. One is pertaining to the PCR test and the fact that we are now able to go and take that test. But I'm just wondering, as you know, is this going to be a false sense of security? Because, you know, with the relaxation of some of the quarantine rules, like how Cuomo encouraged people to go ahead and get together for Memorial Day, as long as they practice the social distancing, which, you know, I think is kind of unrealistic. But, you know, if I were to like go to an outing and then afterwards or beforehand go and get tested and make sure I don't have it, then wouldn't that stand to reason that I should probably have to go back after I'm around people? Like, how much is too much for us to keep going to get tested as the quarantine rules are starting to relax and we want to try to, you know, have some type of social interaction with our family and friends? And then the other thing is that I keep hearing that this is a virus that cannot survive in a warm climate, or it doesn't like warm weather. However, when I'm looking at, like, you know, the numbers in Brazil and in Miami, the infection rates, that seems to like be contradictory to what is being reported. So I don't know if there's just a misunderstanding on my part regarding what the warm weather factor is. And then the last thing is that everyone is reporting that this virus is going to hit again very hard in the fall. How is that being determined so far in advance? How, if we're practicing, you know, if we're all pretty much self-quarantine at this point in time, how is it that, you know, they're putting the fear of God into us about what's coming in the fall?
Ooh, okay, a lot of good questions there. Okay, so let's take the warm weather first. So this virus is in a family of viruses called coronaviruses, right? The COVID is coronavirus disease. Many, and there are hundreds of coronaviruses, hundreds of them. And they mostly, some of them cause a cold in the human beings, some of them don't infect human beings, they infect other mammals, et cetera, et cetera. So we know a lot about coronaviruses, the family. But, you know, you could say that most of my family likes to play music, but that doesn't mean that my cousin John likes to play music. In general, most of my family likes to play music. John actually doesn't like to play music. So it's a kind of a similar thing. You know, many coronaviruses don't grow well and don't move around well in warm weather. But honestly, we don't know about this one because we just got this one. So in the beginning, I think you were hearing, it was in the media a lot. I try to track the media because that helps me understand some of where my own and other people's questions come from. People were talking about, could there be a break in this with the warm weather? From exactly what you said, if you look at warm weather countries and municipalities, it doesn't seem so. So I think that was a speculation. We still don't really know because we haven't gotten to really warm weather. But it doesn't seem that heat inactivates it as much. What is true is that the transmission is typically household and tight workspaces where people work for many hours together. And during the summer months, in general, the population as a whole, not everybody, spends more time outside. So spending time outside, is better to control the virus than spending a lot of time inside, especially with a lot of different kinds of people. So we could get a bit of a break because of our own behaviors. But if the virus is still in lots of little pockets in our population, when the colder weather comes back and we spend more time indoors, and maybe, as you suggested in part of your other question, what happens when we start easing up on the restrictions and people ease up too much? Those are the concerns about this quote unquote second wave, that our behaviors will change in general because we'll be spending more time indoors, as we all do. And that will mean more opportunity for the virus to transmit itself between us. And also, everyone is worried that we're going to ease up the restrictions too much. And if that happens, from a public health point of view, we're going to have to slam them back on. So one researcher in this, he calls it, we're about to go into the period, what he calls the dance. We're going to see a little bit, and then we're going to do some contact tracing, which we haven't even talked about yet, but we're going to track down the people who you might have infected if you were positive, and then we're going to test them, and we're going to isolate them. And if we do that well, we'll isolate only the people who need to be isolated. Right now, we're isolating everybody. Most of us aren't running into the virus, but we all need to be isolated to protect the whole community. That's the hammer. Boom, come down. Whoa, we got to shut down the whole thing, et cetera, et cetera. The dance is doing these little things. There's a little blip here. Oh, there's a nursing home. Oh, okay, we're going to get in there. We're going to separate everybody. We're going to make sure that we get the right medical care. We're going to isolate the right people. And then that nursing home can go back to its normal operations after a couple of weeks. We're going to do a lot of that. And depending on how well we do the contact tracing, we may be able to live like that for a while. But if the deaths and the number of cases starts going up from a public health point of view, then we're going to have more restrictions. So that's happening in some countries. If you're watching some of the news, they are opening up certain areas of Italy, but if there's more of an outbreak, then they close them again. So, and that's all over. I mean, I just read about Italy, so that's in my head. So warm weather, it doesn't look like it, but we still don't know. Second wave, very possible, because that's what these viruses do. And we're going to be outside a lot in the summer, but then we're going to be back inside. And yes, if we don't do the easing of the restrictions carefully and all together as one New York, it's not going to work if some people in certain kinds of workplaces do it differently than other people do, because then the infection is going to start getting some headway there. And that's going to be hard to do. I mean, New York's doing an awesome job right now. So we know we can all work together, but you know, we're a big, crazy city. It's hard to get us all as one. We've done it before under other emergencies. So that's why it's so important to be talking in groups like this, because you're gonna help us in city government, and we're gonna help you, and that's if we are gonna get through that period, that's the only way we're gonna get through that period. I mean, that's just true. It's not gonna happen otherwise, and we're watching that in other parts of the country. where the people in the government are at odds with each other. Those guys are playing Russian roulette with the virus, for sure. Maybe they'll get lucky, but if they don't, they're going to have some big infections there.
Thank you.
Yeah.
Okay, Eileen, I'm going to go ahead and mute you. And Ms. Lorraine, give me 1 second. Okay. You're
Hi.
on.
I was fascinated with this conversation, and I have a dilemma. Doctor, I don't know, I guess you can offer suggestions, but I have a certain amount of buildings that I talk to the tenants at least once or twice a week, find out how they're doing, what they're doing, and I try to gently encourage them to test. You understand that the impact of the virus has had on the Black and brown communities. We all know, but my average tenant is not interested in testing, and I try to be so diplomatic. I walk on eggshells, say, listen, are you interested in testing? Are you, and really try to gently broach it, and they're just not interested. They say, no, I'm good. A couple of young ones, I've been in the house since March, and I have not been out, and I'm good. They're not good, but I don't know how to diplomatically say it. I'm in a very strange place with them, and I'm fearful because the numbers that we see as it relates up to some of the communities that I'm in touch with are not real, because some of them may have it, may not have it. The thing is, I don't know if it's worth knowing or not knowing. I don't know. This is a strange situation that we're in. They don't know. They don't want to know. I'm good. I'm fine, I said, well, would you like for me to send you the information?
Right.
And I do send them the information, but they're not. I can't even. I encourage, and if it don't, you can't force it. You really got to use diplomacy, and I'm practicing it to say, well, listen, maybe we can, you might be, and there's no, I'm good. I don't want to press because I don't want to be turned off. I would imagine that they listen to the news, but I just don't know, and I know that our numbers may or may not, because they may not. I think that most of them are not showing any signs of.
Well, listen, it may be. So I would say it's good to get tested if the person wants to get tested. If they don't want to get tested at this point, that's okay. There may come a time, and I'm just putting this out theoretically, okay? So I don't want to. There may come a time when, for example, somebody says to somebody in your building, I work for, the health department, and I'm working with somebody who is positive with COVID-19. And they told me that they were hanging out with you outside. And I'd really like to test you and talk with you so that we can make everything as safe as possible for you and your family. In that situation, really, really, really want that person to get tested, because you're trying to break the chain of transmission. And we're all going to have to learn a lot more about all of the incredible work the health department and others have been doing to make those kinds of things, confidential, et cetera, so that people, and we're probably going to learn from you about how diplomatic we can be. I would say it's not imperative. It's not like absolutely necessary now, but I think you want to keep encouraging people to get tested, because that's going to give us at the health department a lot of information about the neighborhood, about that address. I mean, we can look at the test not by name of person, but by their address. And we do all these things to make sure that we can't identify people, even when we're looking at the information. So right now, really, it's up to the individual, but I'm glad you're having those conversations, because they may become more important. I mean, I had at a different meeting, somebody asked me, maybe we should get the whole building tested. That's an interesting idea. We're not recommending that as the health department, but it could be that people in buildings want to do that, and they might, talk to Anita or me or somebody about would that make sense? You guys also have to use your communication strategies carefully and thoughtfully. The most important thing is that people are doing all the things, but it sounds like they are using face coverings. They're, in a building, you want the maintenance staff to be super attentive to the high touch things like the door handles and the elevator buttons and all of those things. But I think by now most buildings, but if people don't know, that those guidances are on the city's health department website. So most important is our behaviors. And then of course the testing is helpful because we want to, if somebody feels sick, then we want to get them in the right place medically. So I think you're doing a great job. I would keep doing that, but also don't feel bad if people don't want to do it, because it's not from a public health point of view, it's not super imperative right in this moment. That's something that could change later. Does that make sense to you?
Yes, it does, and I will continue to encourage that conversation. And the idea of getting a building tested, I got to take a look at that and talk to my superiors and see what their feeling is about that.
Yeah, I mean, that would help people know that maybe you guys, if the building was lucky, I mean, all of us who didn't get it are just lucky that we weren't in touch with people by chance early in March that had it before we did all of this stuff to shut ourselves down. But if you were lucky enough to be in that situation, it lets you know that you're doing all the right things. Or it lets you know, as Ms. Foreman was asking about, is there somebody who has it and doesn't even know? It would be helpful to know that, because then you could help that person out and you could take all the right measures. Of course, all to do this in a very generous, respectful way for people. Nobody wants to get this illness and nobody wants to give it to anybody else. So we all got to stick with that premise. I'm going to have to hop off in a minute.
Okay. All right.
Yes.
Listen, thank you. That was helpful. Thank you.
Okay. Yes. And
Thank you, Ms. Lorraine. I see we have one more question. I think it's Eileen again. I'm sorry. We had said 3:30, and we thank you so much because we knew that it might even be just till 3. So we're so happy that you were able to go till 3:30. And Eileen and anyone else who has a question they didn't get to ask, I'll collect it later, and then maybe we're hoping to do more of these.
Yeah. So, just to reiterate, I think that's a great idea. Anita knows I will certainly make myself available. Anita is in touch with other people who also might have, other levels of expertise and whatever. But I think an ongoing conversation is fantastic. And really, if we can do that at the neighborhood level, that, complements what's being done at this overarching level for the city. So that's a really, I think, I don't know, you guys will have to say, could be very, very effective form of communication.
Absolutely. And thank you again for your time. Eileen just texted me her quick question that we're doing a pop-up event to deliver food next week, and the topic of maybe having testing there for people who come and pick up the food. I'm thinking maybe that's an Anita question that I can follow up on.
That's an Anita question. It's quite hard to do the am I infected right now testing easily, because the person doing the test has to be completely in the full PPE. So ask Anita. I'm not sure that that's being recommended, because we want to be so careful not to put the healthcare workers at risk. But there might be a mechanism to do some kind of speedy referrals or some expedited thing that gets people linked to testing quickly. But definitely follow up with Anita on that. And
will do.
And then she's in touch with me. I gotta run.
Yes, no, thank you again for your time. I'm trying to figure out how to unmute everyone to thank you in one big loud sound, but I can't see it. I'm going to share this recording around. Thank you so much, and we'll be in touch. Thank you, Anita, for setting it up.
Great question. So let's keep the dialogue going. Good facilitation, don't you think? Everyone should say thumbs up for the facilitation. That can't be easy.
Right.
And I hope I get to speak to you all again. I'm going to hop off.
Okay, nice.
All right. Thank you.
Bye, everyone.
That was awesome.
Yes, thank you guys for your awesome questions, and I'll email that recording around. And we'll figure out the next time we're going to do this.
All right.
Sounds great. Thank you. Thank you very much.
You.
Adios, everyone.
Hola. Adios.